Is being a Swiftie affecting your mental health? Watch this video to find out more. Hi, my name is Dr. Gerald Ng. I'm a psychiatrist in private practice working at a clinic called Connections Mind Health. So we must remember that the videos we see, pictures we see of celebrities tend to be very edited, very curated and idealized. A lot of times when we look at these videos and pictures of celebrities, we tend to compare ourselves with them, our life situation, our appearance, and that can certainly have an effect on our self-esteem and our self-worth as well. I think through the age of time, we have seen that many people would follow celebrities, they like their songs, like their movies, and that's actually quite normal. All of us do it at some point in our life, but sometimes this can go overboard. That's why there is even this term that came out called the celebrity worship syndrome. While this is not necessarily a mental health diagnosis, we do see some of this happening in people around. It could range from just looking at following all their movies, listening to all their songs, buying merchandise, but this can certainly go overboard. We have seen people who would harass or even stalk celebrities. I think a lot of times these patients or people may develop depressive disorders, anxiety, and their own relationships in life become very distorted. They might compare their partners, they might compare their spouse. They want them to be just like the celebrity, and that's certainly not very realistic. So besides anxiety and depression, some people that I see also develop conditions like eating disorders or body dysmorphic disorders, where they're just not satisfied with their own body image, their body weight, or even the way they look, and they start to get very frustrated about it, and that can in turn aggravate any depressive or anxiety disorders that they might have. Certain conditions like eating disorder may also develop further and lead to health complications. For example, if they stop eating, they could be malnourished and they lack certain nutrients and so on. I think we need to manage the time we spend online looking at social media. That's important. We should also curate the feeds that we have. I think a lot of times when we tend to see one type of videos, one kind of portrayal, and they tend to go on and on, we need to curate that as well. I think we also need to practice critical thinking, to know the things that we see, to really think hard about whether this is something that benefits me or this is not. If you have someone that you trust, someone close to you, you can even discuss these things with them. If you feel that looking at all these celebrities online is making you feel inadequate about yourself, about your own life, about your own appearance, good to share with somebody and seek their inputs as well. There are a lot of celebrities out there who also talk about their own mental health struggles. I think this is really important because it normalizes the situation and destigmatizes conversations about mental health, allowing people like us and our patients to really start talking about their own struggles. Many celebrities out there also have very motivational and positive messages that they share with the rest of the world. I think we could also take this in and use it as a platform to start talking about positive mental health messages. So on social media, we can follow influencers and celebrities whose content aligns with our own personal values. We should also practice digital detox, where we spend time away from our devices, from our screen, to have quality time face-to-face with the people that we love. We can practice mindfulness to really try to identify whether we are feeling frustrated or upset with things because of the content. And if you find that this is happening to you, do reach out and seek some help. It doesn't always have to be professional help. You should reach out to people around you that you trust. Could be friends, could be family members, could be a teacher, or could be a colleague. If you feel that the symptoms are too severe, for example, you're losing sleep, you're not eating very well, you're sad and depressed all the time, you're anxious all the time, do reach out for professional help. It could be a therapist, it could be a counselor, a psychologist, or even a psychiatrist.